Welcome to the Functional Medicine and Natural Healing Podcast, where we share the secrets to upgrade your digestion, improve your hormones, restore your immune system, and detoxify your body. I'm your host, Dr. Houston Anderson. Now let's get started. The following discussion is for educational purposes only and is not intended to diagnose or treat any disease or disease process. Always discuss any medical treatments or interventions with your personal physician. Hey there, and welcome to episode number 2. I'm Dr. Houston Anderson. I was going over an article today that I just published last week on ulcerative colitis, right? So an autoimmune digestive disorder that many people are suffering from these days. And I came to a point that's more philosophy. So today's podcast is not going to be on ulcerative colitis. It's actually going to be on kind of common pitfalls that you may see in almost every treatment protocol throughout the world. So I see these all the time, and I wonder, and this is something I don't know. I don't know whether the doctors actually know what they're doing and they're doing it on purpose or whether they're not. So when someone comes to my office, I have to assume they're a brand new patient, right? So that's one thing that I encourage everyone to do, first of all. A lot of patients fail. A lot of patients want to label themselves as, I have an autoimmune disease. I'm a Lyme disease patient. I'm an adrenal fatigue patient. And because they think that they're that person, they often can't recover from their illness. Meaning, two reasons. One, because they identify with it and they want to stay with it. Now, obviously, no one in my office comes in here and thinks they want to keep their condition. But the reality is that some of us realize that we enjoy the world we live in and it's nice to eat gluten-free, or we like to, the prestige of being all grass-fed and things like that. So I will say that's a portion of it, and usually that's like an underlying kind of like we had to become okay with it, and so we're happy about it now. So that's the first reason why a lot of people can't heal when they label themselves. But the second reason why people don't heal when they label themselves is because they often are searching for the wrong answers, right? So I may get someone in my office that says, I have chronic fatigue syndrome. And they may think that it's an adrenal issue, right? So early in the 80s and 90s, we diagnosed a lot of adrenal fatigue. And that was like the buzzword back then. But no one ever talked about why you had adrenal fatigue. So everyone wanted adrenal supplements. And I was not practicing in the 80s, but the way I understand it, in the 80s, adrenal supplements kind of worked okay. People would take their adrenal supplements, eat a little bit of healthier diet, and they felt a lot better. But I can tell you in 2020 that I have not found a single adrenal supplement that people take that they feel like they have just changed their outlook, or in other words, their condition completely reversed and they're back to normal. So adrenal supplements, while they may have worked at some point in time, they don't seem to work as well anymore. So that's just one of the stories of why you want to stay away from diagnosing yourself as having a permanent condition. And from the functional medicine perspective, we're saying, okay, we do agree that you might have adrenal fatigue or some other condition like ulcerative colitis, but we want to know why. Why are you having that? And how did you get here, and how do we reverse that? So the second thing I want to talk about today is that probably how you got to where you are is a much longer journey than you can imagine. So a lot of people are like, I was feeling just fine until when I turned 35, and I just all of a sudden went downhill from there, and nobody can help me. So I hear that a lot, and that's okay. But the journey didn't happen at 35. That journey of becoming who you are, or your illness, or your cells returning over and regenerating into unhealthy cells, the energy that's present inside your body, the illnesses that exist, the chronic infection that's been hiding everywhere, that started maybe 10, 15, 20 years ago. Many people have had these from birth. And I think that a lot of people go into their conditions thinking, I never had ulcerative colitis flare before, so I never had, just because I'm using this article as an example, I never had blood in my stools before, so it must have just started. Definitely it did not just start, right? This is not something that just came out of nowhere. It's something that you've had for a long time, that you've either been sweeping under the rug or ignoring, or you had maybe possibly an event that really stimulated it more than anyone else. But as I'm going through this ulcerative colitis article, I'm going through like supplements that are super common that people might read online, even in some of the top functional or natural doctors' articles or videos or podcasts. I mean, I see them on YouTube all the time. And I'm just some of these that I'm going through are just not really root cause supplements. So I like them, but they don't seem to be the root cause of conditions. So what's a good example? I'm just going to use one that I don't. It's hard to say because all these supplements are good. I don't want to throw any specific supplement under the bus, but I'll say this. Let's go with the one that I'm looking at right now. So for gut conditions, I'm looking at psyllium fiber. I wrote a really short snippet on psyllium fiber in this article, and it says, why don't you use fiber in your office? All the research supports the idea that fiber is going to be beneficial for most people, if not all people. And while I do agree that fiber has some awesome benefits, I rarely find that lack of fiber in a diet is the cause of someone's situation. So we don't find that giving someone psyllium fiber or any other kind of fiber like an inulin or a lot of the other prebiotics out there, the fibers that we give them don't seem to resolve their conditions. In fact, oftentimes they exacerbate them. So what we find is that the root of their discomfort or the root of their problems doesn't lie in psyllium fiber. So while I can love that supplement, while everyone can recommend it, while the research can be amazing for it, clinically, we're not going to see as much of a response in patients from psyllium fiber until they reach a certain point. And so that's the caveat to all functional medicine. I may say something that's controversial based upon my patients that come into my office. And I do a lot of digestion. I do a lot of autoimmune. I do a lot of thyroid. I do a lot of fatigue. All of those things are the type of patients that come into my office. If you are a 22-year-old male that has mild constipation, you may take a fiber supplement and it may cure everything you have, and you may just feel like $1 million. But not everyone's that person, right? So my patients are more ill in general, more chronically ill. They've been suffering from something for a long period of time. And here's another one I want to go over. Another supplement that I was just thinking of. Aloe vera. So everyone knows of the miraculous healing properties of aloe vera. You rub it on your skin, it's going to help with a sunburn, it's going to help with a cut, it's going to help with antimicrobial nature. It's going to heal the gut when you put it in there, right? So it's going to go ahead and line that gut. It's going to help the skin of the gut, so to say, start to heal. The catch is, we never figured out, so maybe you didn't figure out, or most people don't actually figure out why in the world they need aloe vera in the first place. Why is the inside of their gut inflamed? Why is the inside of their gut irritated? And most of that's going to come down to some kind of environmental factor. So it could be an environmental factor of organisms that live there all the time, right? The infection piece. It could be motility issues, right? So you just got backed up and then things started to grow, which gave you more like imbalance, dysbiosis. It could be a food that you're eating that's irritating you for some reason. And these food sensitivities, they happen all the time and they can change. And they can throw things off for a while enough that your body can't recover from it without a little bit of aid. But if we go back to those kind of like underlying causes, I don't find that aloe vera, for example, is going to actually, quote unquote, address the root cause. And root cause is a term we throw around there all the time. In general, we'll say that most medications are Band-Aids, where they're just trying to calm a symptom down, but not really asking the question, where did that come from? Now, of course, we can always play that game with both natural supplements and medications. So if I take an antibiotic, for example, an antibiotic is addressing maybe a root cause, we could say, because you might have a bacterial infection. You take an antibiotic, it kills the bacteria, and then you're better. You don't have to take it the rest of your life. It solved a problem, and now you're better. So to me, that's close enough to a root cause. Now, if you were to get bacterial infections over and over, say you're getting 6, 7, 8 times a year and you need an antibiotic all the time to treat this, now we're saying that antibiotic may not be treating the root cause of infection. Or in other words, why does your body continually get infections? Why is it going to that state? And then you'd have to dig a little bit deeper. But the same thing could be said for any supplement that you take. While I love supplements and I give them to all my patients in my office, it's important to assess, why is it that some of my patients or some people out there have to take this liver support or this gallbladder support or this hormone balancing pill all the time. And if they have to take any supplement all the time, then we're kind of missing one of the root problems. And some of these root problems maybe aren't addressable. So I'll give you an example. Maybe you have a really stressful job And that job is just extremely stressful, and it creates a suppression of the immune system. And so your immune system is allowing you to have more infections than other people. Your solution then is to get rid of the stressful job and not have a stressful job anymore. But of course, then you may not be able to pay your bills. You may not be able to find another job. You may not be able to support your family. And with all of that, then you would have just as much stress. So the solution really isn't there. So that's when we would say we do want some kind of a Band-Aid solution. How do we, for a short period of time while you're trying to figure out the rest. So you want a Band-Aid solution that's going to allow you to keep your stressful job for a period of time. Maybe you're working your way up the ladder and it's, you're promised a raise and a position upgrade in 6 months, and then everything will be less stressful at that time. Great. Or maybe, your significant other lost their job and you're working a job right now, but they're going to find a job in the next 6 months. And once that's resolved, or maybe your house just flooded, or maybe you had mold, or maybe you had the coronavirus pandemic that's going on, and everyone is just stressed. And there's nothing we can do about that at this current time other than work on, kind of remedies. And so that would be okay to do a Band-Aid supplementation of an adrenal support, or to detox more frequently or something like that. But it's important to know whether you're really addressing a root cause or not. So many of the supplementation protocols that I see out there are not addressing a root cause. And one of these reasons, as to not really throw, once again, anyone under the bus, but you'll find that the doctors are giving, that actually see patients, are giving pretty good protocols for these things, whereas the layperson oftentimes is missing that. So you'll see this in functional medicine. You have the diet-only people. And the diet-only people are truly missing a large part of functional medicine where supplementation can really help. I see people on extremely restricted, super healthy diets, awesome diets for 6 to 7 years without resolution. And then they take like a pill for 1 week, a supplement, an herbal remedy for 1 week, and then all of a sudden they're better. So they suffer for all this time when really what they needed was just a little bit of extra support from the outside world. So my point is, if you're stuck in one world or stuck in another world, you may be missing the root cause. So don't overdiagnose yourself. Don't accept the fact that you're going to be sick forever, and make sure that you keep digging deeper to figure out what the root cause of your situation is. If it's not something that you can get rid of, if it's not a stress or a lifestyle habit that you can get rid of, then go ahead and supplement to mitigate that in the meanwhile, but realize that at some point in time, you're going to have to address that lifestyle stressor in order to get healthy. And we'll see you on the next episode.